So, Tara, this can be confusing for people because this word, anticholinergic, is the first time they've ever heard of it.
Right, so, anticholinergic. It's really hard to say.
I've been saying it wrong the whole time.
Cholinergic,
Consistently wrong.
Yeah.
Very well done.
Good job. It's very hard to understand what that is, but this is a very broad class of medications. And really what we're talking about are drugs that block a neurotransmitter or a chemical messenger called acetylcholine, right?
Yes.
This is one of the first neurotransmitters discovered, very widespread in the body throughout the central and peripheral nervous system. And it has a lot of functions. It dilates blood vessels, it regulates muscle contractions, bodily secretions, heart rate. And in the brain, it has effects on attention, concentration, and memory. And like you said, a lot of Americans use these drugs, whether prescription or over the counter, ranging from things like antihistamines or anti-allergy medicines, sleep aids, bladder control medications, Parkinson's drugs, COPD meds. I mean, the list goes on and on.
So how significantly can anticholinergics increase the risk of dementia?
Well, this is very interesting. So we knew about some of the short-term risks associated. So these drugs can cause things in the short term, like confusion, delirium, memory changes. But the idea was that if you come off of them, it may be reversible. In the mid-2000s, more and more research started coming out saying, well, actually, there might be long-term effects where it may be increasing your risk of dementia. And as you mentioned, there was a study just last month that looked at over 200,000 individuals in Britain who took a strong anticholinergic drug for 3 years, and they in fact found a 49% increased risk of dementia.
49%?
49. But it's important to point out, as with a lot of studies, this was not a cause and effect studies, right? So most of these studies have just shown an association. It's an observational type study. In addition, a lot of researchers have said, look, some of these drugs that we're giving, the antidepressives and the sleep aids, we're giving to people who may have had dementia all along, because some of these things like depression and sleep loss are signs, early signs of dementia. So it may not be the drug themselves that's causing this.
So a lot of these combinations of drugs seem to be the root cause of the problem. My question is, like, with so many doctors making so many prescriptions, really, it seems like the buck stops with your pharmacist.
Well, the pharmacist and the doctor and the patient. I mean, everybody needs to be informed about this. And the fact is that elderly are more susceptible to these types of problems. And there are a lot of reasons why we say that. You know, we know that the blood-brain barrier, that permeability or the ability for medications to cross, increases as we get older. The amount of acetylcholine, that neurotransmitter, decreases in our brain as we get older. So you can imagine if you're now giving a drug that blocks it, you're going to have a stronger effect. The body may not process the acetylcholine as well. And a lot of the elderly may be on multiple medications. So it's a cumulative effect.
Do we know if you stop taking these drugs, did the effects reverse themselves?
Well, this is just a growing body of research, right? As I said, this is association. So what researchers have said is what we really need is a randomized control trial, which is the gold standard type, where we take people who are on these medications and then deprescribe. We take them off and we see what happens to their risk of dementia. But really important is just to speak to your doctor, right? At every visit, you should be going over all your medications and saying, do I need to be on this? Is it really working for me? And what are the potential risks and benefits? Are there alternative agents that might be good for me? And don't assume if it's over the counter that it's safe. It may not be, right? Benadryl, some of these other medications you can buy over the counter, Tylenol PM, Advil PM.
If you're a patient, talk to your doctor, but if you're a caretaker, you might want to review the medicine that the person in your charge is taking. One of the cases described in the literature was really remarkable. A woman went from severe dementia, changed her medications, suddenly she's back to normal functioning.
Right, and so patients with dementia should really not be on these medications at all. So yes, important if you're a caretaker as well.